The most important video in the series on RIBXCAR, what is done. I'm sure all of you who have been following me and watching my reels on RIBXCAR technique will be wondering, what is it? What is being done? So let's move forward. The first part of this video is going to talk about what are the pre-operative requirements. Second part will be the procedure. And in my next video, I'm going to talk about precautions and recovery. So the first thing, what is done before we start the procedure? First, you have to make sure you don't smoke hookah, shisha or cigar or tobacco, whatever. No smoking for at least 3 months. Alcohol is not that much of a problem, but we need to stop it. Blood thinners or any other medicines need to be told, and blood thinners have to be stopped at least 10 days prior. We need a CT scan, a 3D CT scan reconstruction of the ribs in order to see the attachment of the ribs and shape of the rib. In this procedure, the lower 3 ribs, the 10th, 11th and 12th, 10th, 11th, 12th ribs are remodeled. Sometimes the 12th rib is very small, and then in that situation, we go to the 9th rib. So the 9, 10, 11 are remodeled. But how do we know that? So we need a 3D CT scan reconstruction of the rib cage to see the attachments and the length of each rib. Sometimes what happens is that even though 10th, 11th, 12th are remodeled, it is the 9th which is the biggest, causing the maximum dimension of the waist. So in that scenario, we even go up to 4 ribs. So 9, 10, 11, 12. So it all depends on the shape of the chest. The most interesting thing in a 3D reconstruction is to see the attachments anteriorly, and sometimes additional procedures are required in order to get the best result. The anesthetist has a look at the patient, does all the pre-anesthesia checkup, and then we take the patient under anesthesia. There is a special positioning of the patient in a side lateral position, and then the magic starts. So we identify the ribs, we mark out all the ribs, we do an ultrasound on the ribs, first to identify the ribs themselves, and secondly to see the movement of the lungs, because this is important. We need to document that the lungs and the covering of the lungs, which is called the pleura, is moving normally and gliding normally. So we check that. This tells us that everything is normal and we can move ahead with the procedure. Local anesthesia blocks are given under ultrasound. So we give local anesthesia blocks, and this is essential. This is important because we're probably going to be the first in the country to start the intercostal blocks, the blocks for the ribs under ultrasound guidance, making it absolutely safe so the needle cannot just go anywhere it likes. So the local anesthesia blocks are given, and then the procedure is started. Before that, we have already done the marking, so we identify the line of the rib remodeling. We have defined all that, and then once the patient is in the position, then we start identifying. We usually start with the 12th rib. The procedure involves first scoring the rib with a needle. So basically all it does is it removes the upper layer of the rib, which is a very tough layer. And then the second key step is to make small points on the rib using the special needle piezotome. This instrument is called piezotome, and the needle has been specially designed for this procedure in order to make the whole procedure scarless. And then the rib is remodeled by applying firm pressure on the rib. And once that is done, you can see immediately on table the ribs folding. You can actually see a beautiful hourglass developing. The patient is then taken out of anesthesia. A pressure garment binder is strung around the waist and the abdomen, and this binder needs to be worn for 3 months, and the binder is gradually tightened in order to force the ribs to go further in. And what you see initially and after 3 months is a significant difference. The key thing here is the binder. If the patient wears the binder properly, they can lose up to 15 centimeters from the waist, that is 6 inches from the waist. I mean, just imagine how much of waist reduction can happen. In my next video, I'm going to talk about the post-operative period and the precautions that have to be undertaken.